All right, day 23 of the 27-day mobility challenge here at the Reprogram, and we are continuing on with the lower body essential range of motion. These range of motions that we need, that are necessary in order for us to function in a safe and effective way, or what I would consider a normal healthy way. And remember, these prerequisites are necessary for A, minimizing the risk of injury, and B, minimizing the degree of damage. It could be the difference between a complete strain and a complete tear. All right. So these are, as through the past sort of 22 days, we've been looking at these tools as screening tools. They are not necessarily tools to actually advance the mobility or increase your mobility. Not all of them, some of them are. But they are mainly screening tools that I use to assess your movement capacity. Okay, so yesterday we did the hip abduction, testing adductor length in the straight leg phase. Now today we're going to check the bent leg. So because obviously when it comes to the medial thigh and the adductor muscles, some of them are biarticular, which means they cross the hip and the knee, and some of them are uniticular or uniarticular, which means they cross only the hip. They just articulate the hip. So we use two different methods to bias those different muscles out. All right, and the same principles apply. If we are short in the groin, it's going to affect general hip abduction, which means it's going to affect our external rotation and abduction in the bottom of the squat position. It is going to affect a lot of frontal plane work. In fact, if we do have to change direction quickly during sports or during recreational activities, it increases the chance of things like groin tears, sprains, common overuse injury, tendinitis. And also a lot of times when we do get tight in the groin, we also see a combined tightness of hip flexor tightness as well. So it's, a lot of times we have there's a high chance of hip flexor tendinitis as well. These overuse injuries, tightness. And of course, going down to the knee, that will also, usually what happens is when these uniarticular muscles get short, it affects the biarticular muscles anyway because they're not accessing that movement. So again, it can increase medial knee pain, MCL, ACL injuries. And then of course, because the groin muscles attach into the bottom of the hip, it's going to affect the hip itself, hip impingement, bursitis, lack of external rotation if the hip adductors are tight, hip adductors are tight, and we're going to see that in the movement I'm going to do today. So what I'm going to show you today is a modified version of what's called the bent knee fallout test. Okay, that is the traditional test that the physical therapist would use, and I'm going to show you that now. All right, this is the modified version of the bent knee fallout test. Okay, so traditionally you go to the physical therapist, he'd have you lie on your back, he'd place your feet together like this and allow your legs to drop out, measuring this range of motion, your abduction range of motion. So of course, at the Reprogram, we're going to do this at home using a floor and a wall. We're going to utilize this hip flexion angle. Obviously, if you're lying on a bed at the physio, you wouldn't get that hip flexion angle, so it doesn't necessarily always recreate the same symptoms you feel in terms of measuring this realistic, not functional, abduction range of motion, okay? So what we're going to do is you're going to basically sit right back against the wall, the back completely flat against the wall, back of the head flat against the wall, and then you're going to bring these feet in as much as you can, okay? So the more knee flexion we can get, the more support in the knee we have, all right? So it reduces the tension going through the lateral ligaments here, all right? So, and what you do is you basically just allow your legs to come down, and what you're trying to do is ideally, you want them to actually get on the floor. I'm not sure if I can do that. I almost can. Yeah, I'm pretty much there. I'm pretty much at like a 7 out of 10 tightness there. If I stayed here for a couple of minutes, I could probably get them to the floor. But you get the point, right? So the idea is to get them about as close to the floor or preferably on the floor as possible. Within a couple of inches to the floor is a pass. Anything above that, so if you drop the knees and you're like up here, this is a fail. Okay. Now this would indicate significant tightness in the uniarticular muscles in the hip here, and it would also contribute to a limited external rotation. And it's important to measure the external rotation because when you do start dropping the knees down or adding load to them, you're really going to feel the stretch here, and it's going to let you know what's tight for sure. And not only that, but because you're tight there, what happens is we get a medial pull on the femur, on the head of the femur into the acetabulum. So it closes that centration gap here, right? It buries itself into the socket, and then when it's required to externally rotate as well, we get a pinching or a grinding on the posterior side of the capsule, and that can be a bit painful. So just be aware of that, and it just indicates that you don't have the abduction necessary to allow that joint to stay centrated whilst it's going through that external rotation in this position. Okay? All right, so that is the test. If you like what you're hearing and you like what I do and you want to find out how I can help you, visit the website, www.thereprogramonline.com. We'll see you tomorrow. Check this out.
Hi there, I'm Andrew Graham, founder of The Reprogram Online, and if you're here, it's likely because you are feeling the frustration of a body that just isn't performing the way it used to. Maybe it's a nagging joint pain, the frequent injuries, or the simple truth that despite all your efforts, you're not seeing the results you desire. As a busy professional, I understand how valuable your time is. You want a body that not only performs well, but one that you can enjoy and that you know is capable of handling whatever life throws your way. Yet, finding the right path in today's fitness industry is like navigating an untamed jungle of misinformation, quick fixes, and empty promises, often leaving you frustrated or worse. That's why I created the Reprogram, a comprehensive training system designed to not only build a strong athletic physique, but to do it in a way that prioritizes injury prevention, joint health, and longevity. By merging concepts from physical therapy and strength and conditioning, the Reprogram targets and alleviates the very issues that are keeping you from moving forward. Starting with our free mobility assessment, we will identify these issues, as well as your potential risk of injury, and design your training program based on your results. You see, many people think they need more, but often what they really need is better. It's not about lifting the heaviest weight or doing endless reps. It's about focusing on what truly matters so that you can build a body that's not only aesthetic, but resilient. A body that works with you, not against you. The Reprogram is built for men who understand that their body is their most valuable asset and who refuse to let joint pain and past injury dictate their future. Using the 3-stage training system, you'll regain your mobility, correct muscle imbalances, and improve your posture, all with minimal equipment. I mean, imagine your life where you're not just managing pain, but actually eliminating it and getting stronger every day. Believe me, I understand the frustration of trying to stay active when your body seems to resist every step. But with the right approach, that frustration can quickly turn into fuel for change. The Reprogram is designed to respect your time and deliver results in a way that actually teaches you about your body. So, are you ready to break the cycle and unlock your potential? Then I invite you to start your journey today. Remember, this is about you, investing in your future, your health, your quality of life. Click the Get Started button to begin your free mobility assessment. I'm Andrew Graham, and I'm here to help you banish pain, optimize mobility, and unleash strength one step at a time. Let's get started.